Hi, Dr. Neill.
Hello.
Hi, good evening.
Fun.
Good, how are you?
Not too bad. It's been kind of a busy clinic day, so trying to keep caught up.
Yeah, of course. So this shouldn't take too long. Hopefully you'll be able to get back to your stuff.
Okay.
But I sent you those questions. I have a couple new ones, but most are similar to the ones I sent you. It's recording now, but we'll go ahead and get started, and then I'll kind of debrief at the end and stop the recording.
Okay.
User is online.
Can you hear that? Like when my computer goes off? Okay.
I do hear that, yeah.
That's our messaging system. Let me just sign out of that. So I can make sure that that doesn't interrupt us. Okay. Hopefully that doesn't come up again. Who knows?
If it does, that's okay. We'll edit this anyways.
Sounds good. All right. So how do we get started?
Yeah. So first, I'm just going to have you start. Give me your full name.
Okay. Theresia Neill.
All right. And then your current title.
Family medicine physician.
Great. And where did you go to medical school?
University of Kansas, the School of Medicine Salina campus.
Okay. And then where did you attend residency?
Smoky Hill Family Medicine Residency in Salina.
Okay. And then correct me if I'm wrong, Dr. Kellerman told me you just graduated like a year and a half ago.
No, just this past June, July.
Okay.
We just graduated. So pretty recent.
Yes. And then can you speak a little bit about your current position and what you do on a daily basis?
Yeah. So I am a full spectrum family medicine physician. We do inpatient medicine, some ER medicine. We do clinic. We do procedures in clinic and in the ER. And then we're getting our OB program back up and running. And so we've started to deliver babies too.
Great.
So quite a bit of everything.
Yeah, that's wonderful. And then can you tell me a little bit about the patient population that you treat?
Okay. So we are in a rural area. Our town population is about 2,500 to 3,000. There's about population of 5,000 in our county. So we treat everybody around here. We have newborns. We treat pregnant women, children, people that are and adolescents, and then all the way to elderly. So we have many long-term care patients in our assisted living and our long-term care home as well.
Okay. So now we're going to talk about some COVID questions. So what unique challenges did you and your practice face dealing with COVID-19?
Well, I think that it was definitely unique being just so new out of residency. It was nice to have a little bit of experience with COVID in residency. So we kind of dipped our feet into it, but moving to a new area and then being brand new in practice, and also our senior partner had basically retired around that same time. And so we were taking over a lot of extra duties as far as like health officer between the three of us, and dealing with a lot of health department issues along with that. So it definitely added an extra layer of complication in addition to starting a new practice so recently. And so it just seemed to take everything and just elevate it to the next level from that. So
Yeah. So, what were some of the barriers and obstacles you faced during the start of COVID? And you can even speak to, since you were in residency during that time as well.
Okay. So I guess professionally, as far as the barriers with COVID, when with residency, our patient numbers got cut drastically as far as face-to-face encounters. And so that I think that definitely had an impact. Thankfully, I was already through most of my third year, and so had already gotten most of my numbers that I needed for graduation. But you could tell that it really impacted our first year residents that were coming in and trying to get as much experience as they could. For a little while, the residents were not able to go into COVID positive rooms, and our faculty were going in there just to help minimize exposure. But also, if one of us was positive and we were on a certain team, we had to quarantine because who knew like who exactly got exposed and where we got exposed from. I feel like that was a little more prominent when we were in the initial stages of COVID, and now that's kind of tamed down a little bit. But probably professionally in a private practice standpoint, it's just made everything a little bit more complicated. And from a personal standpoint, especially in residency and even starting in a brand new practice, not being able to see family and not having the support system that you usually would around you, that's been pretty difficult, and was more difficult before vaccinations and everything started rolling out. So I think that really affected like work-life balance, because especially with COVID, and we had an outbreak at that point, not being able to see your family, but also having to work extra hours on top of it for COVID specific encounters, that definitely was an obstacle for us and myself.
Yeah, so a lot of people have brought up this idea that COVID's kind of superimposed the idea of burnout in medicine. Have you faced that challenge being a young physician and coming into such a difficult task?
I think it's difficult to say burnout because you're still really excited about all the new opportunities in a new position. I am actually thankful that we're going through this as we're being new physicians rather than 10 years in when you probably are a little more burnt out and stuck in a rut per se, and then having to get out of that rut very quickly to take on this new thing. And so I'm actually a little thankful that we're going through this now. From a personal standpoint and professional, I can definitely see how some people are getting burnout. So thankfully, I had good support through our hospital and administration and my partners to help prevent that. So
good. So, how did you kind of manage that professional life and personal life doing a move during a pandemic? What did that balance look like for you?
So between residency, graduation, and starting a new job, it was nice to have that little bit of time off, because I think it helped us probably self-isolate a little bit more, but we could really take some time for ourselves and not have to deal with a lot of that. I would say it was probably a little more difficult for myself because we were moving to a new town. We were trying to build a house. It wasn't built yet. We were living in a camper for 6 months. So that really had an impact on us. Probably that was probably more stressful than part of the COVID stuff, actually. But also, trying to make sure that you're doing right by your family, and that you're spending enough time with them or corresponding with them enough to help maintain those relationships and make sure everybody was doing well for yourself and for them. And so I really tried to focus on that to just help maintain that work-life balance.
Good. So what have you learned through this pandemic?
I think we've probably all learned quite a few things. I've learned that technology has its ups and its downs. Very thankful that we have technology to do Zoom meetings for our patient visits, because otherwise a lot of our patients could have fallen through the cracks and not have been getting the care that they needed to get. I'm thankful for technology and getting the vaccinations and everything up off the ground. But I think that overall it's pretty amazing what science can do, and getting that technology with it, both of those together, I think has been really beneficial for us. So
Good. Let's see. What did you feel that you did right during the pandemic?
So what I think I did right, I tried to learn as much about it at the beginning as I could, to help my patients, to try and keep up on new technology, because at the very beginning it was changing so quickly that it was hard to keep up, and trying to make sure that you have the equipment and everything that you need for your patients, and continually trying to get PPE and all of that. I think that's probably one thing that I really tried to focus on, and that helped later on. Overall, like personally, I really tried to do a lot of self-isolation and tried to maintain that. If I'm going to tell my patients that that's what they need to do, I felt like I needed to do it myself. And so I feel like that's something that myself and my family did right as well.
Good. If you could do anything over this past year, would you?
For myself, I think I did most everything that I could correctly. There's definitely a few situations as far as patient care that you always maybe wish that you could have done a little bit differently, caught a little bit earlier. But I think probably overall as a healthcare system, we all wish we had a little bit more PPE in stock. So that would probably be one of the biggest things, just especially rural areas, trying to maintain your emergency management systems and not get complacent with that, is something that I'll probably focus on in the future.
Yeah. Who were some people that inspired you or impressed you during the COVID pandemic?
So I was really thankful for my partners. I think that they offered a lot of support. Overall, the physicians who were working on the vaccinations and everything, who really got that technology up off the ground and got us through the fundraising for it, and the technology for developing it so quickly, that has been really impressive. I know that has its own ups and downs, but I do think that that was a feat for them to overcome. Overall, I've just been impressed by the people who have stood by science and trusted science, even when everything was so politicized, with the vaccinations and COVID-19 and everything. And so I've been really impressed by the people who actually trust us as healthcare providers and will take our advice.
Yeah, that's been difficult.
Yeah.
Yeah, I can't imagine on your side of this side of it's also challenging.
Yes, definitely.
So how do you see COVID impacting the learning of students and residents in family medicine? I know you already mentioned less patients in that March, April, May period, but anything else?
I overall does like the less patient encounters, but also COVID-19 just kind of took over everything as far as learning. And so I'm afraid maybe they didn't learn the normal things that we would generally have in our medical education, because COVID was so integrated into this entire past year. And so making sure that everybody is still able to pass boards and pass steps, and have all the knowledge that they need of everything else, in addition to the COVID coverage that we've had over the past year. So I can see that being having a negative impact.
Yeah. Were most of your lectures and everything just moved online, or were any canceled? Did you have any issues with the content you were getting?
I was already kind of past that med school era. So with we had a lot of our noon conferences, which is kind of our learning time during residency, that went to online, or we would only be able to have a certain number of people in a room. And that happened probably for the last several weeks to the last few months of residency. But overall, I think with med school and residency, we rely on each other so much for social support and mental well-being, that's something else that I can see a lot of people struggling with, just because we do need other people, and maybe they weren't getting as much support as they needed.
Yeah, I had a pediatric resident who said she hadn't seen one of her other co-residents in 4 months because rotation and then just scheduling. So I can imagine.
Yeah.
So what is your sense of where family medicine is going in the future?
I think that it's difficult to predict where it's going to go. I know a lot of people think that it may go by the wayside. In rural areas, I think that's far from the truth. We rely so much on our training, and having physicians in rural areas is very important for our patients, especially with full spectrum family medicine, because we are their everything out here until we're referring out. And so no one else can replace our training, and I think that that probably says it all. And if we don't have physicians in rural areas and for primary care, then our patients will suffer. So I think otherwise it's alive and well and has a bright future, as long as we recognize the importance of having physicians in primary care.
Yeah. So are there any views on important issues in the specialty related to COVID-19 that we haven't addressed or that you'd like to share?
Um, I'll put in a plug for rural family medicine, because I think it's important, if you are planning to go into family medicine and seek this out, that you have the appropriate training. There were so many cases in our area a few months ago, in like the end of October, November area, that we weren't able to send our patients elsewhere. So our COVID patients were inundating all the hospitals around us, that they literally could not take any more patients for any other reason. And so even if they were a cardiac patient or a trauma patient, we had to keep them longer than what we would usually prefer as a critical access hospital. But coming out of a residency that trained me so well, I felt comfortable doing it. And so just seeking out that residency that really aligns with your values and the kind of care that you want to give, I think that's important.
Yeah. Okay, so that's the end of my questions. Is there anything else you'd like to add, or anything?
No, I don't think so. I guess I'd like to give props to my partners who moved out here with me. We went to medical school together, and Dr. McKellar and I went to residency together. So Dr. Miranda McKellar and Dr. Josh Katie, especially with our senior partner retiring, I feel like we really came together and tried to maintain things as well as we could and figure things out in what was a really trying time. So
Yeah. Okay, I'm going to stop.